Good morning. It is now 10 o'clock. Thank you for joining the Building Your Skills, Developing a Support Plan series. I think we'll just wait a couple more minutes here before we get started. We still have people joining. We're at 173 attendees at this time. We ordinarily have quite a few people. So just if we can be patient, we'll maybe get started here at 10:02. Okay, good morning and welcome to Building Your Skills, Developing a Support Plan, Episode 7, Assistive Technology. My name is Andrew Johnson, Support Planning and Informed Choice Policy Lead with the Disability Services Division. Thank you for attending our monthly webinar. First, some general housekeeping. We'll be recording this webinar so participants can view it at a later date. Everyone has been muted as they've joined the meeting. Once you've joined the meeting, please connect your audio. You can click the connect button. You can choose your connection method by selecting computer audio, call me, or call in, and you will automatically be on mute. Okay. To ask a question during the presentation, use the Q&A panel in WebEx. Make sure your ask is set to all panelists. This ensures that all our panelists will be able to see your question. So our agenda for today, we're going to first go through some announcements, and then we're going to get into episode 7, Assistive Technology. And you'll note Lauren isn't here today. She wasn't able to join. So if you regularly or have attended these in the past, Lauren is typically our MC and speaker. I am covering for Lauren today. So if there's anything I can do to, I guess, improve your experience here, please feel free to put that in the chat and I'll do my best. Okay. So our announcements, August is back to school month. For all of us, back to school can be a busy time of year. For people who are in school, it is extra important to check in and check up on their support plan. Due to changes in informal support, school schedules, or other circumstances, a person's support plan and the services they receive may need to look different going into the school year than it did over the summer. It is recommended that case managers and support planners of all kinds take a moment to check in with people and their families around the start of school time. Questions that might be helpful to ask when checking in: will the services and how they are being delivered continue to meet the person's need during the school year? Is there anyone at the school the case manager or support planner may have permission to share information with? Is this a big transition year that requires additional coordination? For example, graduation, new programs, or new support needs at school? Asking these questions can help prepare the case manager for updating the support plan, service authorizations, and providing additional direction to the providers to help support the person. Additionally, as people and their families are preparing for what is next, DHS recommends every family check out the tools and resources at Disability Hub MN for Families page. You will see a link provided in the resources section at the end of this presentation. So as a reminder, the revised version of the My Move Plan Summary was published on August 1st, 2022. The revised version promotes a more personalized planning experience for people who need supports and services. It also reduces duplication of the support plan and aligns with requirements based on the person's specific needs. And for more information, you can view the archived e-list announcement. And I believe that link is also at the end of this PowerPoint. So what did we hear in July? We received 99 survey responses, and 93% of those respondents reported that they plan to attend the next month's presentation. So we're hearing that it seems to be pretty helpful. And the most common suggestions for improvement were to provide the PowerPoint prior to the presentation, to use more complex scenarios and examples, and to keep using scenarios and examples. The most common future content suggestions were to provide correctly completed community service and support plans, community support plans that are up to DHS standards, how to write, what and where to write it, common mistakes that are found in the CSP and CSSP, facilitating difficult conversations with a person's support team. We thank you for your feedback and hope that you're noticing changes as we develop our training from month to month. So in our survey feedback, we also had questions about the launch of the revised MinChoices application. And for more information on the launch and changes, please contact your supervisor or MinChoices mentor. There is a monthly webinar series for mentors that goes out from September 2022 to July 2023. And these webinars will cover topics such as launch overview, training plans, current functionality, enhancements, defects, and what to expect on April 3rd, 2023. So why the Building Your Skills series? Why are we here? DSD and the Aging and Adult Services Division heard feedback from you, and this series is intended to provide training to case managers, care coordinators, and assessors who build support plans. We intend to use these meetings to pilot topics related to building a support plan and gather questions in order to create online modules. The training is foundational. We intend to begin at the basics and to build a foundation for future training. So who's present from DHS? Myself, Andrew Johnson, Megan Malumbi, Case Management Policy Specialist with the Disability Services Division, Maggie Munson, Waiver Policy and Compliance, Amy Rumpsa, Customized Living Policy, Sue Kavendru, Special Needs Purchasing, Deb Maruska, also from Special Needs Purchasing. So questions and answers. We'll be taking questions over the Q&A panel in WebEx. So due to time constraints, we'll be able to respond directly to a few questions that relate to the content that we cover, questions that do not directly relate to the scope of today's training or are situational will not be addressed here. And to get a response on those types of questions, please use the DSD contact form or email the Aging and Adult Services Division at the email provided. And now let's get into the key content, building your skills, developing a support plan, episode 7, assistive technology. So you may recall from previous episodes that so far we have discussed the assessment process, results, and how those results affected the planning process, specific information to gather and review to help you prepare to meet with the person, the importance of researching and gathering information about service and support options to help make an informed choice about available options. Information to share with the person about what they can expect and preparing the person for their role in the process of building their support plan. The concepts of support types, that is people and community, assistive technology, and services when building a support plan. Also, informed choice and its importance to and for people. If you missed a previous Building Your Skills episode and want to find more about these topics that we've already covered, you can find them on the training archive page. There's a link on the resources slide, but if you'd like, you can Google MNDHS Training Archive. Again, that's MNDHS Training Archive. It's the first link that pops up. You'll have to scroll down to the Building Your Skills section and select the training that you want to review. So today's learning objectives are to define assistive technology as it relates to a support plan, illustrate why assistive technology should be explored as part of building the support plan, to discuss how informed choice requirements relate to the technology options surrounding the person, and to be able to paraphrase assistive technology, how it should be represented in the support plan. So please note that in this presentation, we refer to the person, meaning the person who is receiving support and services. Some people may make decisions with the support of their families or legal representatives. So areas of need and support types. Addressing areas of need. In our first episode, we defined areas of need or identified areas of need as they relate to the assessment. Areas of need, also known as identified needs, are areas of life in which a person may need assistance. Some examples of areas of need could be communication, work, school, or living environment. The assessment should have those needs documented. Areas of need can relate to support needs in that various services or supports may be identified or chosen to address any areas of need. Within the process of developing a support plan, the case manager or care coordinator would review the assessment to identify services or supports that could be helpful to the person and what areas of need the chosen service or support is intended to help address. There can be more than one service or support addressing the same area of need. It is not necessarily a one-to-one match, but each support should be matched with at least one area of need. So to address areas of need is to identify people, community, technology, and/or services that will support a person's needs, their choices, and the life they want to live. In episode 3, building a foundation with the person, we introduced the concept of different support types. These support types illustrate the options surrounding the person to provide the help they need to live the life they choose. Many of these concepts and practices come from Charting the Life course. Charting the Life course is a universally designed framework that can be used by any person and was created by families to help individuals and families of all abilities and ages. And they really focus on what is important to and for the person when building a person-centered support plan. And a good support plan, first and foremost, must be meaningful to the person. And to keep the person at the center of our work, it's important to understand each of those support types and how they relate to the person and the sequence in which these supports are discussed. So jumping back here, the support plan includes the following support types: people and community, support technology, and services. And today we'll be exploring assistive technology. So let's see here. Assistive technologies include a wide variety of tools or equipment, which can be high tech or low tech. Its primary purpose is to help someone do things for themselves that they would either need a caregiver to do or help with. Remote support and supervision includes a variety of technologies that are used to help a caregiver, supervisor, and/or support someone who needs this type of assistance without having to be constantly physically present. The two can be used separately or together, and both fall under a broader category often referred to as support technology. So what is assistive technology? It's any item, piece of equipment, or product system, whether acquired commercially off the shelf, modified or customized, that is used to increase, maintain, or improve functional capabilities of individuals with disabilities. So assistive technology is not just the equipment, but also includes the human expertise to assess a person's needs, to determine or design the best technology to meet those needs, and then to train and support its use. So some examples of low tech may include pencil grips, magnifiers, reachers, weighted silverware, bowls, and plates with suction that hold them in place. Examples of high tech would be things like electric wheelchairs, communication devices, eye gaze technology, smart home devices. So what is remote support? Remote support is the delivery of a covered service by a staff or caregiver who is in a remote location and is engaged with a person through technology that utilizes live two-way communication. Examples include live audio feeds, web-based monitoring systems, global positioning systems or GPS, mobile applications, communication devices, smart devices, or devices that meet the requirement for live two-way communication. So remote support is not a service. It is a method of delivering an approved service. The technology equipment used to facilitate the provision of remote support must still be funded under one of the services that fund the equipment. For people on the DD waiver, the equipment is funded under Assistive Technology service, and for people on the brain injury, CAC, CADI, or EW waivers, the equipment is covered under specialized equipment and supplies. If the equipment meets the definition of monitoring technology, it can be funded under environmental accessibility adaptations, also known as EAA, which is helpful to do whenever appropriate, as that saves on a person's cap. What is live two-way communication? Live two-way communication is the real-time transmission of information between a person and an actively involved caregiver. It can be conveyed throughout the exchange of speech, visuals, signals, or writing, but must flow both ways and be in actual time. All transmitted electronic written messages must be retrievable for review. If using equipment that meets the definition of monitoring technology, the monitoring technology usage policy must be followed. And you'll see there's a link provided in the slides, and I believe it's also in the resources section of this presentation. As this definition explains, communication is not just verbal or written, but also includes nonverbal communication, such as visuals or signals. As we know, people express themselves and/or communicate their needs in various ways. Therefore, the technology that is being selected to make the remote support possible needs to take the person's method of communicating into account. If using equipment that meets the definition of monitoring technology, the monitoring technology usage policy must be followed. Scope of remote support. Remote support is not a service. It's an available service delivery option to meet a person's health, safety, and other support needs as needed when it is the chosen and preferred method of receiving services by the person or their guardian, if applicable, appropriately meets the person's assessed needs, is provided within the scope of the service being delivered, is provided as specified in the person's support plan. Importance of assistive technology. Assistive technology can help, Assistive technology can help people reduce their reliance on caregivers, improve their health, increase access to their community, and to help reach goals. Case managers and care coordinators are in a great position to have conversations with the person about the benefits and opportunities for assistive technology when developing the support plan. People who rely primarily on in-person support may be reluctant to try other types of supports, such as remote support or assistive technology. Case managers and care coordinators will work with the person to engage in support planning discussions about how assistive technology may be available to meet their needs, and will provide the person with the resources and information they need so they can make an informed choice. So what are the benefits of remote support? Increased independence. As more workers continue to seek opportunities to work from home, assistive tech paired with the remote supports may make it possible for people receiving services to maintain longer working relationships with their preferred staff members. It may also minimize passive caregiver time. This is referring to the time staff are waiting to be needed. For example, during sleep time, doing something for someone who could do it for themselves if provided the right tools and training. It may also maximize active caregiver time. So this is referring to the times when direct physical intervention is needed or is imminently needed on site. So this time can be more effective when the caregiver's time is used more efficiently or the time's truly necessary. It allows a person maximum independence and control. So controlling mood in the environment, taking medications, communicating with others, and etc. It also allows the caregiver to spend time on other important tasks and or with others who need them. And then lastly, maximizing self-dependence. When caregiver is physically present, who has control and responsibility? So the person-centered equals the person has control and responsibility. When reducing physical presence or intervention of caregiver when truly not needed, and when people have the right tools, we see more trying and doing for oneself, self-esteem, advanced skill development being enabled. For example, how did we all learn to cook and take care of ourselves and our homes? Often it's through trial and error. It's very hard to make and to learn from mistakes when there's always a physical presence from a person. So sometimes it's helpful to just try things out, to learn how to use the tech, and to plan for mistakes, but to also leave room for those experiences. So why is incorporating support technology so important? As you all know, we have staffing shortages. Technology offers our greatest chance at surviving the current and future staffing issues, which are projected to only become worse. Reliance on direct support workers. So here is the number of current people working as personal care aides, job classification, which covers anyone who does one-to-one work in the home, in employment settings, or in direct social service types of jobs, but not considered professionals such as case managers. This graph shows a needs projection of growth reliance on direct support staff if support plans continue to rely on direct support. Workers and in-person services. This information was taken from the labor market information and deed projections. So assistive technology requirements. Incorporating technology is not just a good idea, it's required by state and federal authority, such as the Minnesota Olmsted Plan, the Person-Centered Informed Choice and Transition Protocol, and Minnesota statute. The links to the specific authorities mentioned here are below in the resources section of the training. And if you're interested in learning more, please take a look. It's great things to learn and explore. So what's required? People must be given the opportunity to make an informed decision about the available technology options. Minnesota state law requires that all adults and children who have disabilities may use assistive technology, remote supports, or both to enhance their independence or quality of life, and that each person accessing waiver services must be offered the opportunity to choose assistive technology, remote support, or both after an informed decision-making process. So, and this must occur at least annually as part of the person-centered planning process. Please note that when we say at least annually, this is the minimum requirement. Excuse me. As stated in previous Build Your Skills episodes, ensuring an informed choice is an ongoing process. It's not a one and done step in planning. And further, it's required that people be offered timely opportunity to make an informed choice. That is, people who do not live on an annual planning cycle. These discussions must occur in a manner that fits with each person's life circumstances and needs. And later in the presentation, we will review the informed decision-making process. So to meet the requirements, you will complete the following steps. 1, complete the informed decision-making process. 2, identify the support that assistive technology will provide. 3, establish the emergency backup plan. 4, identify a plan to monitor the assistive technology supports. And 5, document this in the support plan. And as we go through the presentation, we'll provide a detailed review of these steps. And before we go into the next slide, I just want to check in. Do we have any questions?
Hello, this is Megan. We do not have any questions right now to answer, so you can continue on, Andrew.
Thank you. Thank you, Megan. Okay, so assistive technology and people. How can support technology address areas of need? How we structure the discussion of support types and available options will affect a person's choices and ability to live the life they desire. We start by adapting services to fit with a person's life instead of adapting a person's life to fit the services. To adapt services to fit a person's life, we must take time to understand their life and the life they want to live. We must understand their goals, rituals, routines, preferences, and needs. Assistive technology can provide increased independence for people. For people without disabilities, technology makes things easier. For people with disabilities, technology makes things possible. That comes from the IBM training manual in 1991. To address areas of need, identify technology that can support a person's needs, support their choices, and supports the life they want to live. So you may remember Jose. A few months ago, we introduced him. And as a reminder, Jose lives in rural Minnesota. He was recently determined eligible for the waiver and would like to continue living in an apartment on Main Street. He has complex needs related to diabetes, and mobility. His family is concerned about his management of blood sugar and the big stairwell leading up to his apartment. They're concerned he may have another seizure related to low blood sugar and fall. Jose wants to stay in his apartment. When a service like PCA or skilled nurse visits are unavailable or have limited availability, Jose may be required to adapt his lifestyle to their schedule or their availability. This may interrupt other life choices, like when he is able to go to work, when he can go biking, when he stops by his favorite coffee shops or cafes. These activities are important to Jose because he has meaningful relationships with the people at work and at the cafe. If he isn't able to do these things on his schedule, it may disrupt, or worse, it may end those relationships over time. So Jose shared that he wanted to continue living in his apartment. We discovered that Jose has that to help Jose do this, we would need to start planning by addressing the whole person. This is planning that accounts for Jose, his family, his friends, and his community. That's those people at the coffee shops and the cafe. It is planning that ensures services are not a barrier to his relationships, daily life, and culture. So how we sequence the discussion of support types and available options will affect a person's ability to live the life they choose. So we start by adapting services and supports to fit with a person's life instead of adapting the person's life to fit services. And as we're doing this, we're talking about integrating assistive technology. So let's consider how we can explore people and community and assistive technology options that may be available for Jose to meet his health and safety need of diabetes management in relation to blood sugar monitoring. So how could we address this? How could we help manage the blood sugar with support technology, with support from people, with support from a service? And we'll explore that through the informed decision-making process. So informed decision-making and informed choice is an ongoing process that happens through engaging person-centered conversations and activities. It is circular, and it does not occur just one time. It's an ongoing process. Informed decision-making and informed choices are a key part of building a support plan. So you're gonna explore and present the available options to Jose. You're gonna think what natural supports does Jose already have in his life that may support this need. You may consider what technology may exist to support the person or their supports. And how may assistive technology empower Jose to manage his blood sugar more independently? So plan around Jose as the whole person, including relationships, preferences, goals, and culture. So consider how can Jose's natural supports in people and community support this need? If there was a technology available to support this person, how might that make people and community more available to support them? Would the availability of technology empower people and community to support the person? Okay. Provide opportunities for Jose to learn about assistive technology options. Does Jose want to meet with people that use technology to monitor blood sugar and seizure activity? Would it be beneficial for Jose to meet with assistive technology experts or to get an assistive technology assessment to explore those options? And has Jose had sufficient time to learn and experience and understand the options? Does Jose want to create a plan for learning about technology options, or is he ready to try to use the technology and to help support those needs? So we have talked about what the transition may look like and accounted for barriers related to those options. What are the benefits and risks of using technology or not using technology? And finally, what is the backup plan? So after thorough planning and going through the informed decision-making process with his case manager and taking time to learn about and explore options with the help of providers and experts, Jose decided that he wanted to use a combination of his natural support system, smartphone apps, and an alert system that has an alert button to monitor falls, and an option to alert caregivers if blood glucose levels are getting too low. Jose's family will access Jose's charts to help monitor overall trends, as well as receive any emergency alerts. Jose's case manager has documented the specific support the technology will provide to help meet Jose's needs. Specific actions, steps, and support instructions for Jose and others to monitor the technology, and an overall plan for monitoring the technology as part of monitoring the support plan, and a backup plan related to the use of assistive technology. So you may also remember Myrtle. Myrtle lives in an urban community near her daughter and son. She has another son that lives out of state. Myrtle attends church once a week. She is an avid Twins fan and listens to the games on a regular basis. Myrtle's husband passed away 5 years ago, and Myrtle recently had a fall and is now open to the elderly waiver. Myrtle lives at home, but her family wants her to have more support in her home so she is safer. Myrtle doesn't want to move. So let's explore Myrtle's routine. When we talked to Myrtle in our original example, we learned that so far, Myrtle enjoys taking her kids every day talking to her kids every day, knitting and morning coffee with her neighbor. She enjoys church and that she enjoys baking and making goodies. Myrtle loves her home and does not want to move. She recently had a fall, and her family was worried about another fall or another emergency when she's living alone. To provide Myrtle and her family with peace of mind, Myrtle wears a pendant around her neck that has several features that help Myrtle and her family feel better about her living alone. It can detect falls and is set up with a call tree if Myrtle doesn't respond that she's okay. The PERS, it first calls her neighbor, then calls a couple family members, and lastly, emergency services. It also has a button for her to push if she needs immediate help. This pendant is called a personal emergency response system. It's often referred to as PERS. The PERS helps Myrtle and her family to know she has a way to contact help when needed. So if Myrtle didn't have a PERS, a personal emergency response system, how might her choice to live at home have been impacted? If we didn't take time to understand the whole person, the roles that people in community play in Myrtle's life, how might that have limited Myrtle's choice? Perhaps Myrtle and her family may have felt that this wasn't a viable option, or worse, that Myrtle couldn't live on her own. So when considering support technology, think about the support technology can be programmed to send alerts to anyone the person chooses, not just paid supports. It could be the neighbor, it could be a family member, it could be somebody that they know at a cafe or a coffee shop. Those could be parts of their community that we may not have considered. If there was a technology available to support the person, how might that make people in community more available to support them? You know, that person at the coffee shop or that neighbor may have thought, you know, I'm not ready to do that. But when considering assistive technology or remote support, they may think, you know, that might be possible. And would the availability of technology empower people in community to support the person? So it might really change a person's picture of the support options. Informed choice. So you may remember from May's episode, informed choice is decision making based on accurate and complete information. It happens through ongoing person-centered conversations and activities, and it occurs when a person understands the options as well as the risks and benefits in any given decision. It occurs when community resources and supports are valued and explored. So you may remember from understanding the options takes time, experience and clear information that's accessible to each person. When we don't have what we need to make an informed choice, things are just happening to us in our lives rather than us making decisions and being in control. Everyone has the right to make an informed choice. It's a basic human right. And while there are many components to an informed choice, this definition provides a great overview of what informed choice means. So why is informed choice important to the person? People with choice and control tend to be healthier, safer, and more independent, more likely to be employed, are better able to recognize and resist abuse. In contrast, people who lose control over their choices in their life may feel helpless. They may struggle with low self-esteem or depression. Informed choice is important for people to make decisions on the things that are important to them and for them. Informed choice promotes independence. These findings come from the Informed Choice Standard at the Disability Hub MN, and there will be a link for more resources provided at the end of this presentation. So this is one of the Charting the Life course tools called the Integrated Support Star you see on your screen now. This tool helps have a conversation about what supports a person has throughout their day and allows you to broaden thinking about supports and take an inventory of different areas of the person's life, including their personal strengths, technology, community, relationships, and eligibility specific supports. There are examples of each support in the categories here, but in some cases, there may be a category that doesn't have many supports identified. This is a great way to easily identify areas around which supports can be built. Supporting the whole person. Support technology impacts a person's choices, independence, and lifestyle. When developing a support plan, think of support technology as a way of supporting the whole person. Remember, the whole person is the person, their family, friends, neighbors, and community. These are people that will be in the person's life with or without formal service eligibility, and it's these people who are key to living an integrated life. to most successfully support the person, it's important, or it's critical, excuse me, that their choices for support technology be a foundational part of support planning. So, just remember, a world where services are a barrier to a person's lifestyle or relationships is one that does not support the whole person. It's critical we talk about these first and build supports around them. So, planning for support technology in the support plan. So the steps to address assistive technology in the support plan are engaging the person in an informed choice or informed decision-making process regarding the assistive technology support options, identifying the support that assistive technology will provide, establishing the emergency backup plan as it relates to the technology, identifying a plan to monitor the use of the assistive technology supports, and documenting in the support plan. So we'll be exploring examples of the support plan a little later in today's presentation. And before we go on to the next slide here, go back. Do we have any questions coming in?
Hello, this is Megan. Yes, we do have a couple, and we are working on an answer for those. Maggie, are you able to pop on here?
Yeah. Let's see. Did you want me to read the question, or are you going to?
You can go ahead.
Okay. So one of the questions that came in said, if a request for an adaptive technology is submitted for the new or latest version of that technology model, which is very expensive, how should you proceed with that? So basically, it's a two-part answer. If an individual is using, let's just use an example of I don't know, what's an easy thing? An electronic door opener, right? And then there's a new version that comes out. The first thing that you want to look at is the current version that they have, is it meeting their needs, right? That's what we're most concerned about. Is the assistive tech that they're using addressing the needs? Is it effective? All of that. Once that is established, the other thing to keep in mind is that MHCP assumes a 5-year lifetime on any equipment. And so if they had gotten the previous model within that 5-year time, and now they're essentially requesting an upgrade to the same type of equipment to address the same need, you would need to have an authorization for that and identify why the current version of the equipment is not adequately meeting their need. Did you want me to do the other question as well?
Yeah, that sounds good.
Okay. So the second question that came in says, if someone has maxed out their annual amount of $39,000 for modifications to their home, but still is in need of assistive tech, could they be approved for additional funding in order to receive assistive technology? So I'm assuming that this is referring actually to the $40,000 a year that's available under EAA. And so the answer is that it kind of depends, because there are a number of assistive tech items that can be paid for under more than one service. And so if they've maxed out their EAA for that year, and the item that they need could possibly be covered under supplies and equipment, and they have not hit their 3909 for that, then you can see if it could be paid under that service. It just kind of depends on the exact item. Also, the other thing to keep in mind is that there is an EAA exception request process. And what that does is it allows an individual to basically access the $40,000 available to them the next year early. And so then they can actually use $80,000 within this year and then just wouldn't have anything the next year. And there's a process that you can do to submit those exception requests to DSD, and then they will review them. So that would kind of be the second option to look at.
that is it for the questions right now. So thank you so much, Maggie. Andrew, I think we can continue.
Great, thank you. Okay, so coming back to the content here, we're going into planning for support technology. And you'll see on the screen here the steps that we identified earlier on, such as the informed decision-making process, identifying the support that assistive technology will provide, establishing the emergency backup plan, and identifying a plan to monitor the assistive technology supports, as well as documenting in the support plan that information. So let's go through the informed decision-making process. Your role as a case manager care coordinator is to engage people in discussions about their options. Planning for the whole person is critical to ensuring that assistive technology is part of the conversation. Remember, people may be reluctant to try new technology options that they have never tried before. It's important to engage the person in the informed decision-making process, to give the person all of their options, to plan for the whole person, to connect the person with the resources and experiences that they need, and to identify and address barriers, as well as to give the person enough time to explore their options. Okay, you are not expected to be an assistive technology expert. Your role as a support planner is to connect the person to the resources, the tools, experiences, and information people may need to understand and ensure they understand their options about assistive technology. As you are support planning, you must be able to describe what is possible with the assistive technology and to help the person understand how it might help them, to offer the opportunity to help the person learn more and to learn from others. That could be from professionals, that could be from other people receiving assistive technology support, as well as to develop a plan that meets the person's needs. So part of that plan may not only be the use of the technology, but it should also be considered how to use the technology, right? So, and then consequently, if the technology doesn't work, what's the backup plan? So coordinating services and supports based on the person's needs and preferences. Each person has unique needs and unique preferences, and the use of technology is not, as well as any other support, is not generic. That is, there needs to be a conversation about each person's needs and what they prefer and their comfort level with using the different types of supports and how it fits with their daily routine and their relationships. Thinking about that whole person. Supporting an informed choice is creating a plan for the person to learn about and experience using assistive technology. This includes providing examples of how other people use technology to meet their support needs, connecting people with others who use assistive technology so they can learn more, meeting with those technology experts, arranging a formal assistive technology assessment, and establishing trials for the person to practice using the assistive technology, as well as discussing and weighing the benefits and risks of any technology. For example, online videos might be helpful for showing examples of how assistive technology may be used to meet the person's needs, or perhaps the person might be open to visiting an assistive technology supplier where they can try out some of the devices before making any commitments. So to learn more about technology options, contact the Minnesota Network in Education for Assistive Technology. It's also known as MinNEAT, to find someone to perform assistive technology assessment if needed. Use the Minnesota Guide to Assistive Technology framework to learn how you can assess someone's technology needs. review online videos and trial runs of technology devices. You'll see there's a link there for Technology Resource Center. Connecting the person to waiver services that can cover helping people to learn new skills and to become more independent, including skills necessary to use technology. There are services that may include family training and counseling, individual community living supports, individualized home supports, and specialist services. And you'll see on the screen there are links to CBSM for more information on those services. Next, you'll identify the support the assistive tech provides. So after exploring the assistive technology options and connecting the person to experiences to understand and learn more about the options, identify assistive technology that will be used to meet the person's needs in their support plan. Consider the supports and services in the person's plan that will use or monitor assistive technology to help the person. Clarify and discuss exactly how assistive technology will support the person and their needs. So continuing that part of identifying the support, have discussions and document in the support plan to develop a shared understanding of the support being provided, including what technology is being used, who is using and or monitoring the technology, what are the action items and support instructions for using and or monitoring the technology, how the technology equipment will be monitored for updates and functionality. As you may know, technology is constantly changing in our lives. There's often improvements, changes, and there may be steps that the person will need to be supported in to make those changes, to get the latest, to make sure that their current tech works. And creating support instructions will help to ensure that each of these supports understands their role and that the person understands what they can expect from each of those people. Establish the emergency backup plan. Once you have identified assistive technology and the way technology will support the person and their caregivers, the next step is to discuss the backup plan with the person. You may be identifying technology in the support plan to help meet a person's assessed need, or you may be identifying support technology to provide backup support to the person in the event of emergency, or it could be a combination of both. So not only may the person identify technology to help support their needs in their support plan, the person may choose to receive emergency backup through technology. This is to say that you may not only be planning for when technology that you have identified in the support plan are temporarily unavailable, but you may also be identifying technology as the backup support for unseen events. Or for unavailable staffing that puts the person at risk. The backup plan should be monitored and updated as needed. As we know, technology can provide many opportunities and provide innovative support. However, it's not always reliable. So it's critical to have that backup plan. So think of Jose's blood sugar monitoring tool. Maybe this technology was added as the backup plan for Jose at first, so that when his family or professionals weren't available to support him, he would have the necessary support to monitor his blood sugar and falls. However, after Jose became comfortable with the technology, he decided he preferred to have more control over when and where his in-person supports came into his life. And he decided to have the technology be his main support, and the in-person supports and staffing became the backup support to the technology. So in this situation, it reduced the barrier of service in his life, right? It created more flexibility. He was able to maybe go to those cafes more often. He didn't need to be scheduling a visit with somebody to come check his blood sugar or make sure that he hadn't fallen. And monitoring. So monitoring is ensuring the plan is working and meeting the person's needs, as well as documenting in the plan for monitoring the frequency and who is responsible for monitoring is required. You as the case manager or care coordinator will be responsible for monitoring, but others will be part of this plan to monitor as well. So once technology is identified, the support being provided is clarified and discussed, and a backup plan is created. And the case manager must continue to monitor the supports that's being provided. So identifying a monitoring plan. So provide ongoing monitoring and assessment of the person's assistive technology as identified in the support plan. The purpose of monitoring is to ensure that services and supports are delivered in accordance with the support plan, and that the supports continue to meet the person's needs and achieve their intended action steps and outcomes. The case manager or care coordinator must continue to monitor the person's supports, including the adequacy of assistive technology and the monitoring technology that is listed in the support plan. The person and their case manager or care coordinator should update the support plan as needed. This is in addition to updating the plan annually and when the person requests the plan to be updated. If an assistive technology no longer meets a person's assessed needs and preferences, as you have identified in the plan, discuss the support options with the person and lean on the backup plan as needed. The case manager care coordinator must continue to monitor those supports and their adequacy. So let's think about monitoring Jose's assistive technology. Jose values his work and he wants to expand his hours. He wants to continue living in his apartment and in his community. So when thinking about that, we are monitoring to ensure that the technology is providing the support that is needed to ensure Jose has stable blood sugar and is not having falls, both of which could jeopardize his ability to do those things. It's important to determine the frequency of monitoring and how often we may need to check in with Jose and his family. When monitoring the plan, we need to ensure that Jose and his family understand technology, determine if they need additional support, monitor if the technology is working for Jose and his supports, ensure the technology is set up correctly and providing accurate data, and confirm that the technology is meeting Jose's needs and achieving the
Hello, this is Megan. Andrew, if you are still speaking, I think we lost sound. Can others hear me? Maybe a couple people can type in the chat.
Can hear you.
Okay, you can hear me, so it's must be Andrew's audio. Thanks for your patience. Give us 1 second while we try to sort this out. Hello, this is Megan again. I am thinking Andrew is having some audio difficulties. Um, so let us sort this out for 1 second, and then we'll see if we possibly need to transfer the rest of the presentation. Thank you so much for your patience here. Just another minute. Okay, this is Megan again. I am thinking that I will continue the presentation. So sort with me for a minute while I try to share my screen. And I believe we left off at the slide where we were identifying our monitoring plan with using Jose's plan as an example. So 1 minute here. I'm getting the slide pulled up here that we were on, so I'm almost there. Okay. Now I get some thumbs up if everybody can see my screen. Awesome. Okay. Thank you so much for your patience, everybody. I'm thinking Andrew is having some technical difficulties here, so thank you for working with us. So I'm going to start at the beginning of this slide just so that we can kind of recap it a little bit better. So we're talking about a plan to identify a monitoring plan and that the person in the case manager should kind of continue to monitor the person's supports and the adequacy of the assistive technology that's listed in the support plan. So then we're thinking about Jose. So that assistive technology that we developed earlier, after Jose went through that informed choice process. So since Jose values his work and wants to expand his hours, and he wants to continue living in his apartment and in his community. So, and when we're thinking about monitoring that, we're going to monitor to ensure that the technology is providing the support that it needs to ensure Jose has stable blood sugar and, is not having falls, both of which could potentially jeopardize his ability to continue living in his apartment. So it's important to determine the frequency of monitoring, how often we may need to check in with Jose and his family. And we also may need to, when thinking about monitoring, ensure that Jose and his family understand the technology, determine if they need additional support with the technology, monitor if the technology is working for Jose and his support, such as his family, ensure that technology is set up correctly and providing, accurate information and data, and also confirm that the technology is meeting Jose's needs and achieving the intended outcomes, as listed in his support plan. So when trying something new, monitoring naturally might be a little bit more intensive. So the case manager and care coordinator might have to monitor a bit more closely in the beginning to ensure that technology is working and meeting the person's needs. When something becomes more routine, maybe they've been using the technology for a while, monitoring may be reduced over time. So moving on next, we'll kind of talk about, so what do we document in the support plan? First, we'll talk about what exactly needs to be documented in the support plan regarding assistive technology. Also, this is Megan. I just wanted to add to, if there are any questions that I should see right now, I don't have access to that. So if Maggie or someone can just speak up if there's anything that needs my attention, that would be awesome. So, okay, I'll continue here. So what should be documented in the support plan? So a summary of conversations had with the person to explore and learn about assistive technology support options. This includes documenting the plan for the person to learn more about assistive technology, if applicable. So, even if the person isn't currently using assistive technology, we should be documenting in the support plan, what the plan is for the person to learn more about their options, even if they're not using it right now. We'll also document details and support instructions describing how the person and/or other supports will use technology to support the person's needs or goals. So those detailed important support instructions. We'll also plan for monitoring how assistive technology is meeting the person's needs in the plan, and the emergency backup plan, like we discussed. We'll also get into a little bit more detail here about what is needed if remote support is being used. And this can also be found on the remote support policy page, which is linked at the end in the resources section for everybody. But just to go over it here. So when a person is choosing to use remote support in their plan, the following information will need to be documented. So the person's assessed needs and their identified goals that can be met using remote support. How remote support will support the person to live and work in the most integrated community settings. The person's needs that must be met with in-person support. How remote support will not replace in-person support provided as the core service function. The plan for monitoring in-person and remote support based on the person's needs to ensure their health and safety, and whether the person or their guardian, if applicable, agrees to use cameras for service delivery, and then the amount, frequency, and duration of remote support use. So again, that can all be found on that CBSM remote support policy page. So we recommend getting more details there, but we just wanted to kind of go over those requirements if remote support is being used. Okay. We also wanted to discuss where assistive technology must be documented in the support plan. And we kind of talked about this too with when we reviewed, where should informal supports or people in community be documented in the support plan? There's really a number of different areas where you can document technology and the conversations about technology you're having with the person in their support plan. It really depends on the specific need and the support provided. Where assistive technology is documented will really vary depending on each person and each situation. So informal supports do not have to be documented in all of the areas listed above. Rather, informal supports and assistive technology, but they must be included in the support plan. And also, you'll see some differences here with the CSSP and the CCP. And we just wanted to note again that with the MnChoices revision project, there'll be some future updates that make it more clear across case management and clear coordination. So the above differences in the CSSP and the CCP will be a bit more streamlined. All right, next slide here. So we wanted to share some examples. We're using an example of a CSSP for Mohammed, who is a 17-year-old boy who lives at home with his parents and sisters. So I'm going to kind of read this out loud, just so we kind of get a good idea of who Mohammed is. So someday he would like to have his own apartment in the same area as he currently lives with his parents and sister. He attends school during this week. His favorite subjects are math and reading. He has an IEP that directs supports he needs in problem solving, behavioral and emotional and social sensory needs related to his recent diagnosis of autism. He prefers to ride the bus to and from school. Consistency is important to him. He is a strong reader and reads books far above his grade level. He loves computers. He takes pride in problem solving computer-related issues for his family and peers at school. And he's not interested in work at this time. He would love to have a career in computers someday. He really enjoys playing video games, especially Minecraft. He would like to go to the gaming convention in Minneapolis this winter. And someday he would like to experience Minecon, the National Minecraft Convention. And he looks forward to going to GameStop every Wednesday after school with his dad and choosing a game to rent or buy. So music is also important to him. He loves to sing. Once he finds a song he likes, he likes to sing all the time. And then every Friday in the summer, he attends music in the park. We'll go through kind of the next parts of where we see some assistive technology documented here. So in the goals section, we're seeing two of Mohammed's goals that are listed in his support plan. You'll see that he has a couple goals that involve the use of learning about technology. So one, he would like to enroll in a community education class on computer programming. And two, he would like to become familiar with all the functions on his phone, including setting his alarm with music to help him get up in the morning. You may notice that Mohammed does not have assistive technology devices or equipment listed in his support plan that you may normally think of when you think of assistive technology, such as a medication machine, sensory alarms, video equipment, communication device, etc. However, Mohammed does have a goal of learning about the functions of his cell phone so that he can be more independent. And so we're using this example really to show that you may have discussions with the person about what technology the person already has available to them to help meet their support needs and goals. Okay. We also are seeing technology documented in the action steps for goals. So you'll see that the formal and informal supports in Mohammed's life have clear action steps documented to help Mohammed meet his goals. So he has specific action items that are not only using technology to help reach his goals, but also a plan to learn about the technology. For example, before Mohammed can use his cell phone to set his alarms and increase his independence, he has to learn how to use the technology. So there's 2 specific action items that Mohammed has listed. He'll explore community education classes in his area with help from his supports. And he'll find online videos for tutorials on how to use different functions on his phone and to practice setting his alarm. Mohammed's natural support system also has action steps to reinforce appropriate phone and technology use. And Mohammed's service provider will support Mohammed with finding classes, registration, available scholarships to take to the classes, transportation to the classes, etc. So this area of Mohammed's support plan clearly lists who is responsible for ensuring Mohammed continues to work towards his goals and meet his needs with the use of technology, including the specific action steps and who is responsible for which portions of the support. I am going to see how much time. Oh, we're doing pretty good on timing. We should have the availability to answer a couple questions. So I just wanted to check on that. Perfect. The next part we'll kind of look at how technology is documented is in the summary of programs and services section. So Mohammed has a provider providing supports in Mohammed's home. In the support instructions field, you will see there are additional instructions regarding helping Mohammed learn about and use technology. So this section states, he would also like assistance with learning to use his phone to set reminders and alarms and enrolling in community education class. So again, I know this was just an example of, not really any high-tech technology, but an example that really we can have discussions about what technology people are already have available to them and are already using to help meet their support needs. And another reminder that where and how assistive technology is documented in the support plan will vary based on each person's unique needs, goals, preferences, and supports. If the person is not currently using technology to meet their needs or to help reach their goals, a summary of the conversation around assistive technology, including a plan for the person to learn more about technology, must be documented in the support plan. So again, making sure those conversations are being documented that you're having if the person is not currently using technology. That what you might document in the plan could include the plan for the person to use to learn more about the technology, who they might meet with, what other things that you might try, action steps that the person might take to learn a bit more, etc. And we like this image here because it really shows that effective planning does get people where they want to be. Okay. And our learning roadmap. So today we learned about assistive technology as a support type. We discussed how critical it is to build supports, including assistive technology that people have, and into the support plan and to identify how technology can be used to help support the person's life. And in upcoming Building Your Skills episodes, we'll explore more about support types, including more about service options, and we'll continue to talk about kind of the whole person and how people in community, assistive technology, and services can be used to help meet a person's needs and when developing a support plan. Okay, Q&A. I haven't been able to have my eye on it quite as much here. Andrew.
Yeah,
Looks
hi
like
there,
you.
Megan. Sorry, folks, I lost internet connection earlier, so I'm glad to see that things are able to move on here. Thank you, Megan. Um, we have a question here that asks, what happens if you request an assessment for technology, but the county case manager doesn't know how to assist with getting it done? So I think everybody is at a different place in learning on technology, but as a case manager, if you don't know how to do this, you don't know how to authorize it, ask for help. Reach out to your supervisor or your colleagues. And if you're a person that is requesting this and asking this question, then ask the case manager if they can get some support. And if you're still not able to, you can always ask to speak with a supervisor or some other representative from that county or that lead agency. Okay, Maggie, is there any questions that you'd like to respond to here?
But we can certainly answer them maybe in our next, if you can just give me just a couple seconds. Oh, actually, you know what? Let me take that back. There was a clarification on a question.
Maggie, you're a little bit quiet. I don't know if you can speak a little louder or closer to your microphone.
Sorry, is that any better?
Much better. Thank you.
Okay. I did just have a clarification. There was a question that came in that said, can you extend over a 3-year authorization period? I'm not exactly sure what they're referring to. My guess is that they're referring to the EAA exception request, where you can use 2 years worth of funds in a single year, and then that next year you're just using those funds from the next year early. If that's what you're referring to, the answer is no. 2 years of usage is the maximum. Let's see. There's one other question on here. Does the person have to have an evaluation or a doctor's order to get the supportive technology? In general, no. The most important thing is that they need to meet the eligibility criteria. So for example, under specialized equipment and supplies, that service is covered when it allows a person to increase their ability to communicate with others, perceive, control, or interact with their environment, or perform activities of daily living. So it would for sure have to meet the eligibility requirements. It's always recommended that a tech assessment be done, just because there's usually a lot of options out there that people just aren't aware of. And we want to make sure that they're getting the assistive tech that is the most appropriate to what their needs are. And so it is certainly always a recommendation. But the ability to have the waivers purchase the items has to do with the eligibility criteria. So right now, for most items, you would not need, you would not need a tech assessment or a doctor's order, but you would still want to look at the MHCP billing guidelines. There are some things that require prior auths. That is all I have for the moment, Andrew.
Thank you, Maggie. This is Megan again. I wanted to answer, I don't think we answered this one earlier too, but somebody asked if there's a list of assistive technology assessment providers. And this is yes. All agencies providing technology assessments are listed on minnesotahelp.info. And then we also had a question about distinguishing between remote service and another Weaver service. And we just wanted to kind of clarify that remote support is not a service. It's a service delivery option to help meet the person's support needs. So just wanted to clarify that. And we are actually running out of time here. So I'm going to just show you here the next few slides. So the next time, again, we're gonna continue to, well, first of all, I have to say thank you to you all. You really are just so important to helping to support people and helping people make informed decisions when building the support plans. So thank you so much for all the work that you do. You're really ensuring people are living the life they want. Thank you, thank you. And next month, we are again going to talk about the support types and including services when we're building the support plan. So you can get ready for that for the month of September. You can register for future Building Your Skills presentations on TrainLink. The next one is September 28th. And then don't forget to check out the resources section. We have a lot of good resources that we talked about today. And, oh, yep, there's a few pages. In time, I'm not going to read through them, but I do encourage you to take a look. And one final thing is we would really love your thoughts about our webinar and our webinar series. And we would really appreciate you taking a few minutes to complete our survey. We do look at it. We look at all your feedback and suggestions. So we appreciate you taking the time to do that, and we value your input. Don't forget, if your question was not answered today, you can send your question to the appropriate, division contacts using that DSD contact form or emailing the Aging and Adult Services Division at that email address. Okay, and don't forget you can review today's presentation on our training archives page. Okay, that concludes today's webinar. Thank you everybody so much for attending, and thank you for navigating with us with our little technology issues here. We appreciate you coming to these every month, and we hope to see you next month.